When was the last time you smiled on your way to the dentist? Well, that's about to change. Welcome to the Arizona Smile Center podcast with Dr. Sam Bollwinkel. Welcome back to another episode of the Arizona Smile podcast. Scott here with Sam, Dr. Bollwinkel. And one of the things we're going to talk about today, and maybe I walked into your office the other day and I saw what looked like something from the future.
It is futuristic, isn't it?
Yeah. First of all, it came in a box that looked like that leg that got delivered in the Christmas Story, that big wooden box.
That box weighed like 800 pounds.
Yeah, so I was intrigued right out of the gate.
Right.
I'm like, what is in that box? And you said, well, that's...
It was like one of those mini houses that you put on
wheels.
Right.
Right.
I think I lived in it for like 2 days afterwards.
So that was the laser. I'm like, what's
great.
in there? You're like, that's a laser. It even had the Fragile written on the side, which was awesome.
It is the new Solea Laser.
Okay.
Yeah, from Convergent Dental. Amazing technology.
Yeah. And it's a super cool looking little apparatus, but I was like, okay, what does that do? What is it? And so one of the things that we talk about when I think about the dentist, here's my experience with the dentist.
Okay.
My dentist is a kid named Dr. Rigby. I went in one time. He told me I had 28 cavities.
That's every tooth.
Yes, thank you.
Wow.
And so if you look at my mouth now, which you have for years, there's a cavity in every tooth, and so I understand dental
the only way
fear.
I recognize you.
Yes, yeah. So when I was a kid, going to the dentist was probably my biggest fear, other than getting my hair cut by a guy named Ed, who my parents went to for years. So
right, a bleeder, huh?
Yeah. So going to the dentist, and I know a lot of people out there have a fear of going to the dentist. It's probably, I think 70 or 80% of the population has some type of a fear of going to the dentist.
For sure. Yeah, I think they do. It's kind of common. Even getting into the profession early, about 1990s, everyone's like, "Oh, you're going to be a dentist? Do you know that they're the number one suicide profession in the world?" And I'm like going, "That's why I'm joining. That's why I'm going into it."
That's the career path, right?
It's a career path. Yeah.
And so you weren't afraid of that.
I wasn't. I had some experiences growing up as well, where I spent some time in the dental chair as an active adolescent, knocking out a couple of teeth.
Yeah.
We'll just kind of leave that story.
No fights,
there.
just roughhousing.
We're not gonna talk about it. The past is the past. But I spent a lot of time fixing some broken teeth.
Okay.
Yeah.
So you've got experience. I think all of us have some type of experience, unless you're one of those lucky few that have great teeth that never have to go to the dentist, which they're few and far between. But
very few far between. Yeah. And I think the thing that scared me, wouldn't scare me the most, but would be that part that I hated the most. I wasn't a needle phobe. I don't mind getting stuck with needles. I can do that all day long. It's just being numb. I hate the sensation of my face, my hands. Like when my leg goes to sleep, drives me crazy.
Right.
Just that sensation is horrible.
I am a needle phobe when it comes to my mouth. I don't mind getting my blood drawn, but then when I see that needle coming close to my face,
it's a small one though, right?
I know, but it makes me nervous.
Yeah.
So that's an interesting thing that you're not afraid of that, but the numbness part. So
the
numbness part I hate as well. I hate that. I can't drink out of a regular cup for a couple hours because I feel like I'm just going to get myself wet.
Horrible. I've had my nephews will get some work done in the past, and I'll get a call in a picture, and they've chewed up their lip. The whole way home, they can't feel it, and they're just chewing on their lip because they have no idea what they're doing. They just destroyed it, right?
There's something about flicking your face, and as you're feeling it come out of that numbness, that's how you know, okay, it's coming back. I'm getting my feeling back. So
seriously.
So back to the laser.
Yeah.
And let's talk about the laser and what that does and how that, number one, kind of maybe helps us overcome fear, especially for our kids when it comes to kids. But tell me about that, the laser and some of the unique aspects of laser dentistry that help maybe ease some of those fears.
Well, so I've been involved with lasers from the get-go. So 1998, probably the first piece of equipment I bought was a laser. They've changed dramatically. This new Solea laser is actually developed and configured to allow us to perform dental procedures without having to use anesthetic. So no shots.
No shots.
So you hear this thing called no-shot dentistry.
Yes.
I've had patients over the years that just can't stand. They'll just sit there and suffer through pain because they're so afraid of the needle and the anesthetic that they're just going to deal with the pain. It's better than getting the shot.
Yeah.
This is real no-shot dentistry where the laser actually operates at a frequency that shuts down the nerve. So it will make the tooth numb. It will take the tooth structure away and allow me to put a filling in there. And a lot of the procedures that we use the laser with, we're talking 2 minutes, 3 minutes.
Wow.
To do the procedure, put the filling in, total time in the chair, you're like in and out in 15, 20 minutes. So instead of coming in, getting a shot, waiting for the anesthetic to work, having me come in and drill, conventional drilling, and then do the filling, and then polish it up, and then that's 45 minutes to an hour, and then you're numb for the next 2 hours. Right. So it's a half a day procedure for you. It's only 45 minutes for me.
Right. You're on to the next one. Yeah.
Now we're down to 15, 20-minute procedures. The patient's going out with a bottle of water, and I don't have any worry that they're going to dribble all the way home.
It always seems like I schedule my dental appointments right on my lunchtime since I'm still a working adult.
Yes.
And I never get to lunch, and then I'm hungry, and then I'm cranky, and then I associate that with the dentist, and that's why I hate.
And that's why I hate you. There's a lot of hate association.
Right. So
pent up with dentistry.
You're doing this with kids?
Doing it with kids. I had my niece the other day come in. Love her to death.
How old?
She's I'm gonna get in trouble now.
Five,
4 or
6?
5.
Okay.
Yeah, 4 or 5. Okay. And so it's my wife's niece. It's her kid.
Okay.
And she's got some dental phobia, anxiety associated.
The child does, or the mom?
No, the mom.
Oh, the mom. Okay.
And so I could see her anxiety and know it was there. And the little my little, so I guess my niece's daughter.
Right.
I don't know what we call that.
We need a family tree. Anybody got a family tree?
Yeah. How do you, but she was just excited to see Uncle Sam. Hey, Uncle Sam, I'm so excited to be. And she was like, "You're gonna fix my tooth." And Mom was already just like starting to cold sweat,
projecting all of her fears.
Oh yeah. So I had her just wait outside the room and sat down and just told her, said, "We're gonna wash your tooth. We're gonna clean out all the little sugar bugs." And we sat down with the laser, which shoots a little bit of water, but it's about a third less water than what we normally use with a handpiece. And so it's just a little bit of water. We wash it out, put the filling in. It was about 10 minutes. And she was so excited. She just thought that was the funnest thing ever. She got a little prize. And she jumped up, and Mom was just sitting there just, "Oh, why couldn't we have had this when I was that age?"
Right.
And I think I was her dentist when she was that age. That's the horrible thing, right? So it's coming a full circle on me here.
Right. So no pain.
No pain.
She probably equated that to brushing her teeth. When you say I'm going to wash your teeth.
Yeah.
Right. I mean, that's something
little power wash, little car wash, and you can shoot the water out of it, and it's lasers aren't scary for some reason.
Tell me about the sound.
The sound's completely different, right? It's just, it does sound like just washing water. It's a little bit of a buzz, washing water, but there's no handpiece sound. There's not that drill sound. You don't feel it on the tooth. So like a drill, one of the issues with the drill, even though you're numb, you still feel that
the pressure. Yeah, the pressure.
Yeah, which vibrates into your brain because your teeth are like attached to your head. The laser doesn't do that.
And if you're like me, when you get to the dentist office, I lay down in that chair. I kind of put my hands across my chest, and usually by the time the procedure is halfway over, I've constricted my breathing so much because I'm
the hands are white knuckle.
Yep, and that just adds to my anxiety. So that's awesome.
And that for me is fun too. I mean, don't get me wrong. I do. That's a little bit of the the demented side is like, okay, how scared can I actually put my friends and family?
Yes.
What can we really do to but no, the laser is amazing.
So
Absolutely
kids,
amazing.
it's an awesome solution for kids.
Kids, an awesome solution. What's even more impactful, I think, is the adult population. So lasers have always been okay for kids, but they've been very expensive, and so utilizing them is hard. This laser coming out is amazing for adults. I had a patient the other day, about 3 months ago, an older gentleman, farmer, just saw the earth, good guy, been a patient probably 20 plus years in the practice, had been with me for 20 years. Did a little, had a cavity. We went with the laser, did the filling, and literally he got up. I mean, it took 10, 15 minutes. He got up, and he's got the crusty old beard, and he's got manure on his shoes.
Little Duck Dynasty, maybe.
And just goes, "Can I give you a hug?" And I'm like, "Sure, I take hugs. Give me a hug." This was pre-COVID-19. Give me a hug. Social distancing wasn't there.
Right.
He goes, "I've been afraid of the dentist my whole life. I've been afraid of the needle. I've been scared to death." And I'm like, I've been treating him for years and had no idea that he had this anxiety attached to it. And he goes, this just changed my life. He goes, changed my life. I'm like,
the tough guy exterior melted away because now you've got a better solution.
Solution. It's amazing.
That's
awesome. The laser is an amazing tool. We're excited to introduce it to our patients. This one specifically, the Solea Laser. It's not any more charge for the patients. It's just a service that I think is where the future of dentistry needs to be, creating an environment where my patients can be in and out very quickly, efficiently, no pain. It's amazing.
So as a patient, right?
Yeah.
Less time, no pain, same cost. Win-win-win.
Win-win-win.
Okay, I love it.
Just, I've had somebody go, that's so cool to see. I'm going to go get a cavity just so I can get a laser cut on me.
I'm considering buying a bag of Jolly Ranchers on my way home from work today and just sucking those things all night long. Maybe sleeping with one in my teeth. Just so I can experience it. No, I'm not.
I'll let you see the hygienist first,
yes.
and then you can come see me.
That's awesome. Well, I'm excited. I know there's a lot of new technology and stuff out there.
Yes.
I know you're always on the forefront of that and trying to make sure that, number one, you're taking care of your patients, right?
Right. Yeah. It's all about for me, it's all about patient experience.
Right.
How can we make it the best experience possible? We all need to be at the dentist. We all want to take care of our teeth. We want to have that good oral hygiene and be healthy individuals. It's that experience. What kind of experience do you have to go through in order to obtain that? Right. So we've always tried to just make it the best as possible.
Anytime you can knock down a wall that keeps me from doing something that's good for me, taking care of my health, I appreciate that. So, Sam, saying thanks so much, and I'm excited to get in and get my kids in there and have a laser treatment done. And so,
come by and see it.
Until then, everybody out there, keep brushing.
Keep brushing.
Keep brushing.